Hello everyone, my name is Marcos with the Hunter First Aid YouTube channel. I'm a registered nurse and remote area paramedic, and today we are talking about hypothermia, what it is, how to prevent it, and how to treat it. Let's go. We've all gotten cold while hunting, fishing, or just being outside. But how cold is too cold? Hypothermia happens when our body's core is losing more heat than it's able to maintain. So now let's define what hypothermia is. Now, between the temperatures of 95 degrees to 97 degrees, you're not really considered hypothermic. Some textbooks will tell you that you're actually in a cold stress scenario. You're going to be shivering, you're going to be alert, you're going to be able to make decisions, conscious, and generally this is a good time when you start to get in this temperature zone. When you start shivering, that's when you're going to start taking action, hopefully before that, but this will be your body's clue that you need to start taking action. There are three stages of hypothermia. The first stage is mild hypothermia, and that's with a core temperature of 90 degrees to 95 degrees. Now, in this stage, you might start to get some altered consciousness, confusion. The person's not acting right. They're not making great decisions. They may still be shivering, but they might actually stop shivering at this point. The second stage of hypothermia is moderate hypothermia. This is going to be a core temperature between 82 degrees Fahrenheit and 90 degrees Fahrenheit. At this point, the person with moderate hypothermia will stop shivering. This is a very big warning sign that you're going downhill, especially if it goes with altered consciousness, or they'll be irrational. They won't be making good decisions, and they won't be able to take care of themselves at all anymore. And then the last stage is severe hypothermia or profound hypothermia. This is going to be anything below 82 degrees Fahrenheit. At this point, again, they're not shivering anymore, and they are going to be completely altered or unconscious. They're going to be irrational, they're not going to be making sense, or they just might not be conscious at all. So those are your three stages. Again, you've got cold stress, and that's going to be any time that you start to feel cold, but you're not, and you may be shivering as well. You got mild hypothermia, which is 90 to 95 degrees Fahrenheit. Moderate hypothermia, which is 82 to 90 degrees Fahrenheit, and severe or profound hypothermia, which is anything below 82 degrees Fahrenheit. So how are you going to know when somebody has a low temperature like this, especially since most thermometers do not go this low? Well, you're going to buy a hypothermic thermometer. Now, these do not cost any more. You just got to look for a thermometer that is marked as hypothermic. Some people might tell you to do rectal temperatures at this point. It doesn't really make a difference. It's not going to improve your patient care. And honestly, if they're already in this cold of a state, exposing them to get a rectal temperature is only going to make things worse. So oral or auxiliary, which would be in the arms, is going to work just fine for what you are looking for, because you're more looking at the symptoms, you're more treating the symptoms, you're recognizing that, and then working to warm them up. Before we move into prevention, I feel it's important to understand how we lose heat from the body. There are 5 main ways of losing heat. There is radiation, conduction, convection, evaporation, and respiration. Radiation is the infrared radiation that we naturally emit from our body, losing heat. Conduction is direct contact with something cold that draws the heat out from us. Convection is any gases around us that pull heat from us. That's going to be air or water. And evaporation is when we sweat. That moisture on us is then going to draw heat away from us. And then we also lose heat in our breath every time we breathe. So to prevent hypothermia, first thing that you're going to do is dress appropriately. You're going to want to, in cold weather, wear warm clothing. In warm weather, you're going to be aware of moisture. And this could be in moderate weather as well. Moisture doesn't just come from sweat. It comes from rain. It comes from being in the water. Water is 24 times more conductive than air when it comes to thermal conductivity and drawing heat away from your body. So even in a tropical setting, standing in warm ocean, you can still get hypothermic because that body of water is drawing out heat from your body. Dressing appropriate for where you are is going to be a very big factor for preventing heat loss. So in cold weather, layering appropriately. You've got your base layers, the ones that are close to the skin. These are going to be layers that are wicking of moisture, so they pull moisture off your body so it's not just sitting on your body. You do not want to use cotton for this. It holds moisture and it doesn't wick away. Synthetic materials that are made for wicking moisture work very well. I'm a huge fan of wool. A lot of people don't like wool against their body, so they'll use some kind of synthetic against their body and then use wool as the second layer, the mid layer of whatever they're wearing to help trap that heat. But then after the base layer, you want a mid layer that's going to trap the heat, and then you want a good outer layer that's going to prevent any moisture getting in, like rain, things like that. But again, breathable enough that you're not sweating just because you're caught in a layer of plastic or something like that. So layering is very, very important. Good gloves, good socks, good shoes. Now, an important thing to remember, when you are wearing bulkier socks, you need larger shoes. You do not want to wear your normal everyday walking shoes with very bulky warm socks, because what that does is now you're trying to fit a larger foot into the same size shoe, and that squeezing will cut off circulation to that foot, or at least reduce circulation. You need circulation to stay warm. So if you are buying boots that you are going to be wearing larger socks with, make sure to try them on with larger socks. If you are feeling the rest of your body is doing good, but my feet are freezing, loosen up those laces and then retie it looser so that you can get that circulation going. Trust me, I've done this before while snowboarding, while hiking, while hunting, where I've laced it up too tight because I was so excited to go, and about an hour in, my feet are freezing, but the rest of me is fine. Loosen it up, get that circulation going. You'll be able to recover very quickly from that. Layering, very important in prevention. Planning ahead too. If you are starting to sweat while you're moving around, while you're hiking, while you're getting to your hunt spot, slow it down a little bit. Take a rest. You do not want to sweat while you're out in cold weather, because the second you start sweating, that's pulling heat a lot quicker. As I said before, water is 24 times more thermal conductive than air. So when you've got that sweat against your body, it's pulling that heat off a lot quicker. So when you start to sweat, slow it down, take a break. If you know you are going to take a break and you are going to stop, before you stop, maybe put on another layer to help warm it up so that when you stop, you're not putting on cold gear. But planning ahead for rest, if you do rest and you haven't done that, go ahead and put on another layer before you start to get cold. When you're starting to feel cold, you're already behind the ball. So you want to plan ahead for anything like that. If you're in warm weather, going in water, making sure you have the right equipment, the right dive suits, the right outerwear to put on, dry clothing for when you come out of the water. Limit your time in the water. If you're in rain, having good rain equipment is going to make a huge difference to keep that water off of you from conducting that heat away from you. Things that do not help at all is alcohol and nicotine. They are vasoconstrictors. They'll close down your veins, your circulatory system, and you will have a worse time getting blood circulating around your body to keep you warm. The problem with alcohol is it makes you think that you're warm, but you are definitely not, and you will get hypothermic more quickly. Other things to remember to avoid hypothermia: any exposed skin, cover it up. Make sure to stay well hydrated and well fed. You need those calories to make that heat they're naturally in your body. And ultimately, good quality equipment, good quality clothing make a huge difference. So treating hypothermia, how do we do it? We want to warm that patient up. You do not want to do it quickly. You don't want to shock warm them, but you do need to get them warm. There are many ways to do this, and it all depends on the availability of material, the availability of what you have at that moment. Layers. Get layers on. If you're out camping while you're hunting, you're going to have sleeping bags. Put a sleeping bag on them. Make sure to get them off the ground. So getting some kind of mat underneath them to avoid that cold ground contact. Getting sleeping bags on them, getting more clothing on them. You do not want tight clothing. You don't want to restrict circulation, kind of like what I was talking about with socks and boots, but you want more clothing on them. You can even consider a tarp or a foil blanket or a blizzard blanket to help reflect heat back, and that would go over everything. But biggest thing, try to get them out of the elements, into a tent, into a cabin, sheltered by a tree if that's all you have, but get them out of the environment that is causing the hypothermia. You want to get warm water in bottles onto their core, into their armpits, around their neck, into their groin. You don't want to burn them, you just want it warm. So warm water around them in everything, and then put things, jackets, sleeping bags, things like that over that. Another thing to consider is physical movement, generating more heat. Make sure if you're going to do this that they have liquids, they have food to help with that caloric intake, to help generate that heat. If they are not making good decisions, if they're irrational, then they are not able to drink or eat because they will choke. We do not want to do that. So you're only feeding them, you're only giving them liquids, hopefully hot tea, hot water, if they can drink and if they're able to stay in a rational state, if they're not altered. Ultimately, if they're getting to the state where they're altered, you need to get out of where you are. That's an evacuation. That's we're done hunting. We're getting back to the cabin. We are even considering going to the hospital because they might need more than what you can do to keep them and get them warm. Best treatment is prevention. If we can prevent getting to those stages, that is going to be the best thing to go. So make sure that you are prepared when going out. You know the weather conditions that you're going in. You have the right equipment, the right clothing. You know how to use it, and you know how to prevent hypothermia in whatever condition that you're going in. And that you know how to treat it if you need to, whether it's for yourself or for somebody else that you're hunting with. So make sure to stay safe out there. Plan ahead, plan accordingly. If you like what we're doing here and you're learning, make sure to like and subscribe. That way, every time we put something new up, you will get notified. If you want to see a topic that we haven't covered yet, put it in the comments below. Remember, safety is no accident. Stay safe out there. We'll see you on the next one.